What's going on, everyone? Happy Thursday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, September 28th, 2023. And I gotta say, for being the last Thursday of September, it sure is a busy Thursday, which is not a good thing. Starting off, let's do a little bit of a rewind. Anyone remember the governor of Washington, Jay Inslee? If you live in Washington, you know who that is right away. Well, he had COVID for the first time on May 25th of 2022. He then had it a second time on February 1st of 2023. At the time, he was 71 years old. In present times, today being Thursday, September 28th of 2023, guess what? He has tested positive for a third time. So let's rewind. February 1st of 2023, prior to that, 2022, May 25th, and yet again today, a third case of COVID. We're seeing a lot of this happen with political figures now, where they're starting to go on to their third case. So, yeah, not a good thing. Moving on to this now. Remember last week? I think it was last week. We talked about Vermont, how there was a private school with 70 cases of COVID out of 300 students. Yeah, that's not a good thing. And then we said there were 14 outbreaks among schools. That was then. It could likely be higher now. Well, there is now a hospital in Vermont. It's called the Champaign Valley Physicians Hospital that now has 50 staff out sick with COVID. That's right. A total of 50 staff are now out sick with COVID. Masking is returning at the hospital. This, my friends, is not a good thing. And quite frankly, Vermont overall, from what I'm seeing, is just not doing very well. We need to keep tabs on Vermont. Maybe there's a new variant there. Maybe it's the HV variant. I'm not certain. With sequencing being so bad across the country, in different states, and really around the world, you got to keep your eyes open because something is causing a large amount of outbreaks to occur in the state of Vermont. Who remembers back in 2021 when Vermont was supposedly, the most boosted state, and then constantly when you would watch the news, Vermont would always be red on the map, but the news would not report on it. I remember that. And speaking of that, you're going to see some other areas that are not doing well. We'll get to that in a moment. First off, the outbreaks section of my site. There's going to be some changes coming to it. I've made my decision. It's time that we break it up and organize it better. Everything's just being thrown into one section. It's just into one category and one big. And there's now upwards of how many outbreaks are there that I have reported on? Yeah, there's now 106. That doesn't include previous ones that occurred before I started my website, and there's going to be many, many more. So see what we did with COVID studies and papers and COVID positive archive. That's coming for the outbreak section as well. So everything is split up. We'll have a section for the United States outbreaks, Canada outbreaks. I think there's going to be one for the UK. We got quite a few UKs in there. And then another one that just covers the rest of the world. It's needed. My website is basically an archive where you can go back and search information. Say you need to find something. Like you need to find a study. Maybe you know someone that's having problems post-COVID with the lungs. Well, you want to read up about it? Click on COVID's effect on the lungs, and you'll get different studies, and you can go to the websites of those studies and read them. Well, guess what? We're doing the same thing with the COVID outbreaks. Maybe you need to find a past outbreak because you know someone who was in a facility. Maybe there's legal purposes. Whatever the case may be, maybe you're doing research and you need to find out about an outbreak. It's going to be easier for you. All right, speaking of New Jersey, remember we just said New Jersey's not doing well? Well, here's proof of it. 5 New Jersey hospitals reinstate COVID-19 mask mandates. Because, guess what? New Jersey's continuing to be bad. New York's continuing to be bad. We'll take a look at their numbers in just a little bit. I can tell you New Jersey's hospitalizations, they continue to rise. Speaking of outbreaks, we just talked about outbreaks. Well, we know early on in the pandemic, there were outbreaks in senior nursing facilities that impacted older people. You may not hear much about that in the news anymore. That does not mean that it ended. In fact, data shows that COVID-19 continues to significantly impact people 65 and older. Just because the news stopped talking about the older population, which, by the way, we were supposed to protect, doesn't mean that it ended. It didn't. 65 and older are still getting hit significantly hard by the COVID-19 pandemic. All right, moving on to this now. Who remembers last week when the governor of Ohio tested positive for COVID? Well, I thought this was interesting. Now, I don't have numbers yet for this week's COVID cases in Ohio. He's doing a press conference right now as I'm recording this video. He's doing it virtually. That's the interesting part about it. So, in other words, well over a week later, he's still doing things virtually. This is his second case of COVID. Some may argue he had a third case because in 2020 he briefly tested positive and then the next day he tested negative. Whether that was an actual test or a false positive remains unknown at this time, but the fact that he is still doing things virtually means evidently he is still sick with COVID. And I will revisit his live stream. I'll revisit it later on to see what he says and to see what he sounds like, but apparently he's given an update on COVID in Ohio. Last week's numbers did show that Ohio was still rising. We'll have to see if this week was still the case. All right, let's jump overseas for a minute. COVID-19 hospital admissions in England stabilized after a recent rise. Wait, you're telling me here that they're stabilizing? Well, let's scroll down a little bit. Look at this chart. This is COVID-19 hospital admission rate in England per 100,000 people. Okay, they were rising. Then they dropped a little bit. And look at this. They're starting to rise again. So you're telling me that they're stabilizing? Let's take it a step further. This is hospital admissions. This was tweeted on Twitter and X. It shows here that the hospitalizations in England didn't stabilize. It says hospital admissions with COVID in England increased by 10% in a week. So that's not stabilizing. It would have been flat if it's stabilizing. England is still rising at this time. In the early days of the pandemic, UK, England, that region used to be an indicator of what was going to happen in the United States. Well, right now, we are still seeing a rise in New York State and New Jersey. Let's take a look at the air quality values across the United States today, and you'll see it's not terrible, but it's starting to decrease in the Northeast. We have that onshore flow again. We saw it the last time there was an onshore flow off the Atlantic, and that caused bad air qualities. The Southeast is not doing bad right now. This is actually the best the Southeast has done in some time. The West Coast, we still do have some values over 100, but look at the Pacific Northwest. You're seeing single-digit values. That is tremendously better than what we saw out there in August. Walgreens this week, the positivity is 27.7%. The prior week is 32.5%, a difference of down 4.7%. BioBot this week is down in all regions. That's good to see. Now I thought we would take a little look at a couple wastewater sites. We were just talking about Vermont in the beginning of this video, or near the beginning. It was our second segment. And I thought we would take a look. Let's move myself to the right. Thought we would take a look at some wastewater data. Here's Chitterton. This is Burlington, Vermont. Look at this. Rapidly rising. Then it leveled off a little bit. And then it just went kaboom, straight up again. So wastewater is rapidly rising there. 30,000 population. And this particular site, look at it. It's still in the red. That's not good to see. Here's another Chitterton. Doesn't update all that frequently. Here's one that is trying to level off. Here's one that dropped, and it's rapidly rising. We can also go to the wastewater scan site, take a look at Essex Junction. Essex Junction did drop, but look what's happening here. It's starting to rise again on the most recent update. And can we show you Montpelier? Yes, we can. Look at this. Montpelier, Vermont. That's the capital of Vermont. It is, look at this, rapidly rising again. So there is concern of COVID in the wastewater in Vermont as well, and it's showing here. It's coming up as high. This is fantastic. The wastewater scan people now actually include what the actual level is for each individual virus. So that is really good to see. I also do want to show you something down in New Jersey. Let's come down here just west of New York City. Here's Newark, New Jersey. And what we want to take a look at here is not only COVID, and it's not showing the actual level here. I would say it's probably moderate to high at this time for COVID, but look at this. Influenza. It is rapidly rising now at this wastewater site, and this is no small site. 1.5 million population, and we're seeing influenza rapidly starting to rise now. So that is not good to see. Let's take a look at the latest variant proportions. We know the EG.5 is leading the way at 24.5%. HV.1 is at 8.4%. And then coming over to this, we will, by the way, hopefully get another update on the variants tomorrow. I'm very interested to see where HV variant does end up. Taking a look here at hospital admissions, 19,674 in the last week. All right, we have to take a look at Chicago. Chicago, hospitalizations, they did drop a little bit, but the beds in use did rise by 1.7%. Emergency room visits down slightly, cases down slightly, deaths down slightly, and vaccinations administered. Look at this, 2,558. We can assume people are going out to get the booster, so that is a good thing. Now we come to New Jersey. And yeah, New Jersey's not good. They now have passed 600 hospitalizations. Let's zoom in. You can see this wave started back in July, and it's just been continuing a steady rise ever since. Every once in a while, it has these bigger spikes. 23 people on the ventilator. Again, 600 people in the hospital in New Jersey. 65 patients in the ICU. And discharge volume slightly lower today. That means, yeah, people are staying in the hospital a little bit longer. 94 discharges reported in New Jersey today. Now let's cross the Delaware River, take a look at Pennsylvania, and specifically southeast Pennsylvania, Philadelphia. 770 EMS incidents as of September 27th. That's yesterday's total. Let's take a look, a live look at what's going on in the suburbs of Montgomery County. We can see not too bad in Montgomery County here in the Philadelphia suburbs. It was busy earlier in Chester County, and it still is fairly busy. We're seeing a lot of strokes, sick persons, heart problems. It was even busier than this just a half hour ago. Now let's go back through New Jersey, go up the New Jersey Turnpike, and make our way across the George Washington Bridge and check out what's going on in New York City, or New York State and New York City. And this is not good. Nearly 4,000 new cases today. That includes reinfections, so 3,985 cases. Yes, that's not a number we like to see. And hospitalizations, here you go, New York State hospitalizations, they continue to rise, 1,636, and 165 people in the ICU. We can assume, let's go back for a second, with nearly 4,000 cases today, next week we might start to see a bigger increase in hospitalizations in New York State. The admissions will probably increase. I'm figuring with this new wave that's setting in. And remember, there was only 1 week, maybe a week and a half in between waves. I'm figuring with this new wave, it could take New York State over 2,000 hospitalizations, 323 admissions in the last 24 hours. Let's also take a look at New York City because that's important as well. And you can see the admissions in New York City, 134. Number of people in the hospital in New York City is currently at 716 with 76 people in the ICU. I'm expecting at some point, whether it be this wave or around the holidays, New York City's going to go back over 1,000 hospitalized people again, which they have not seen that since, I believe, let's backtrack here. I believe they have not seen that since either late January or early February of last year. Let's see. Yes, they have not seen that since late January last year. Here comes early February. And yeah, early February they started to drop below 1,000. And you can see here, it's just on the pace to rise. I mean, I get it. It's not as high as this time last year. But again, it's quickly. I mean, here's the late September of last year. You can see it was right around 800 to 850, and It's at 716, so it is catching up. Not good to see. Let's take a look at Colorado. Colorado just came in with its update for this week. As of the 17th, the week of the 17th, they had 2,400 cases reported. That is a stabilization and a slight drop. So that is good to see. We know Texas this week did see a big drop in cases. They dropped by 7,423 cases to 14,145 versus 21,568. Taking a look now at the international picture, and we can see Brazil cases dropped significantly by 610%. I don't know how true that actually is. Sometimes the numbers on this website, Worldometers, is wrong, but it says in the last 7 days, it's coming up as 18,837 cases. Then it says preceding 3,696. I don't understand what's going on there. And then we take a look at Romania. Cases are up 32%, and then deaths are up 50%. And then we come down here to Bulgaria, where cases are up 70%. See, these make more sense. It says 1,336 versus 788. So technically, I think that Brazil number, that should be a positive, but whatever. We're not going to sit here and debate that all day long. Poland, cases are now up 18%, and deaths 6 versus 1. That's why it says 500%. Then we come down here to Chile, 24% increase in cases. Mexico has a 29% increase in cases, and Guatemala has a 26% increase in cases. Alrighty, folks, that does it for today's pandemic update. We'll have another pandemic update again tomorrow. Again, repeating, the COVID outbreak section of my website is going to get a makeover. It's going to be split up. It's probably going to take me a few months to get through that. As you may see, the COVID positive archive was never completed. I'm going to do a little work on that later on today. And yep, that's all I have for today. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. And if you know anyone that needs to see these updates, by all means, share this with them. I think the next update is going to be tomorrow because we're going to get that variant data. But stay tuned. As always, I will tweet it out on my Twitter page at COVID Data Report, and it'll say Data Report as the name because I changed it to match this channel name. I always tweet out whether or not I'm doing a pandemic update. If you want to join in on the conversation, join and become a member of my website, datareport.info. It's a great Twitter alternative. I'm seeing that though my Twitter account is, the following is going up, I'm also seeing it's not going up as fast because people are leaving Twitter. I'm seeing it also drop. And I'm seeing a number of people that I'm following drop because people are deleting their accounts. Well, my site, datareport.info, is a great alternative. Some people say, why don't I join Blue Sky? Maybe one day I will, but right now I got my own site and I'm still trying to keep tabs with everything I do on Twitter. It's too much right now. So, but maybe down the line I will. Alrighty, guys, I'll see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic afternoon. Thanks for watching.